Fertility is often misunderstood, and many women don't realize how factors like their age, their cycle health, and their lifestyle can impact their ability to conceive. So, whether or not you're actively trying to conceive or just planning ahead, understand that your reproductive health is essential. So, let's break down the key things every woman should know about fertility and pregnancy. First up, what are we going to do? We're going to define infertility. Infertility is the inability to conceive after 12 months of regular, unprotected intercourse for women under 35. For women over 35, this time frame shrinks to 6 months due to the natural decline in infertility with age. Now, there's a bunch of different factors that can cause infertility, like ovulatory disorders, blocked fallopian tubes, endometriosis, or even the guy. It might not have anything to do with the female at all. It could be male infertility that is causing you to be infertile as a woman. There are things like hormonal imbalances that must be considered, uterine abnormalities like fibroids, endometriosis, even a low ovarian reserve, which is measured by AMH and FSH hormone levels. Male factor infertility includes low sperm count, poor mobility or motility, and abnormal shape or morphology. So you gotta ask yourself, this has been going on for a while. If you have irregular or absent periods, or if you've experienced multiple miscarriages, or if you know that you have PCOS, if you know that you have endometriosis, if you are under 35 and you've been trying to have a baby for 12 months at least, and you know that you've been trying, you need to ask for help. Ask your GYN if you need to see a fertility specialist. Many women don't realize that fertility is strongly linked to age, and women are born with all the eggs we're ever going to have. That's around 1 to 2 million at birth, but this number sharply declines over time. By puberty, the egg count might be about 300,000 to 400,000. So it's just one of those things that it is important to realize. As life goes on, fertility levels are going to get low. So it's very important that you are in tune with your body. You need to know what is happening with your cycles. You need to be aware. You need to be able to track your cycles if you are thinking about getting pregnant. Now, I know this has been a lot of information. So I'm not going to give you a bunch of stuff that you have to do right now. Here's the steps you can take right now. Lifestyle changes, fertility preservation, think about that. And then also maybe some early hormone testing can help you better understand and manage your reproductive health. Like I said, I know this is a lot of information, but it is important for you to go ahead and start thinking about it now, because stress, diet, and environmental exposures all play a role in reproductive health. So just remember, this is a process when you start to think about fertility and you start to think about conceiving and having a baby. It is a process. So go ahead, just kind of start processing everything we talked about. Let me know if you like this video. If you like this video and you want me to dig deeper, let me know down in the comments. Like this video, and if you have not already, make sure you subscribe to the channel. I am Dr. Erica R. Jones, MD, and I'm a board certified family medicine physician that's here to just escort you along your journey of living a healthy life. Bye.